Our GBA program targets beta-glucocerebrosidase, or GCase, to be more simple, to address two diseases, neuronopathic Gaucher and Parkinson. As introduced also in the last presentation, misfold Gcase that can be caused by genetic mutation or age-related stress is known to result in neuronopathic Gaucher and to predispose to early onset and fast-progressing Parkinson disease. Misfolded Gcase leads to the accumulation of glucosylceramide in Gaucher and of alpha-synuclein in Parkinson, as well as of glucosylsphingosine. Currently, there are no cures for either diseases and very limited treatment options, largely directed to symptoms rather than the cause. In Gaucher, available enzyme replacement therapy cannot cross the blood-brain barrier and thus cannot manage the neurological symptoms of the disease. Our Parkinson program has been endorsed by the Michael J. Fox Foundation and the Silver Sun Foundation. And with this program, we are targeting over 7,000 Gaucher patients and over 2.4 million potential Parkinson patients worldwide. The next slide, please. Misfold Gk present in the ER generates ER stress, and the protein quality machinery will recognize it as faulty and thus will undergo degradation. As such, it will not reach its final cellular localization, the lysosome, at sufficient quantities to properly process its direct substrate, which will accumulate and lead to the molecular onset of Gaucher and of Parkinson, as well as through the accumulation of alpha-synuclein. GAIN is developing structurally targeted allosteric regulator that target a uniquely identified allosteric pocket on GCase. Those molecules are stabilizing the misfold GCase, which as such will not be degraded by the protein quality control and will reach the lysosome, where they will properly process the otherwise toxic substrate, avoiding their accumulation, thus counteracting cell death associated with the onset of Gaucher and Parkinson diseases. The next one. We have completed lead optimization, and our lead compounds are GT2287 and GT2329. Both compounds are orally bioavailable and penetrate the blood-brain barrier. Both compounds are well tolerated both in single-dose acute toxicity as well as in 2 weeks multiple-dose studies in mice. The compounds are not cytotoxic and not mutagenic and show no red flags in a panel of off-target protein and receptor. We have been performing mechanism of action in vitro and in vivo proof of concept studies, including also patient-derived iPSC study that Professor Feldman will be presented to you shortly after my presentation. The overall results indicate that both molecules are able to stabilize GCase in the ER, facilitates its maturation and localization to the lysosome to increase GCase protein levels. This in turn is leading to decrease of GCase direct substrate, namely glucosylceramide and glucosylsphingosine, as well as alpha-synuclein in its most pathologically relevant form. These translate in a neuroprotective effect and reduction of behavioral marker in relevant Parkinson model I will be presenting you shortly. The next slide. In the next, I will present to you initial in vivo data that we have been generated in a rotenone rat model. Rotenone, as you might know, is inducing accumulation of synuclein into the rats, which relates and follows to loss of dopaminergic neuron and consequent behavioral deficit. In the next slides, I will be presenting to you data supporting of alpha-synuclein depletion, improved neuronal activity, and locomotion. The next one, please. In this slide, I'm presenting data indicating that GT2287 decreases with statistical significance in a dose-dependent manner alpha-synuclein accumulation in the substantia nigra, as you can see reading the blue bars, when measuring both total and phosphorylated synuclein. The next, please. GT2287 improves viability of dopaminergic neuron, as you can see to your left side when we measure tyrosine hydroxylase, which is a marker for viable dopaminergic neurons. The more abundant dopaminergic neurons leads to more dopamine being produced, and this you can see at the center of the slide. To your far right, you can appreciate that GT2287 induces a reduction of a relevant neuroinflammatory market, namely IBA2, which is a specific market of microglial inflammation, a relevant aspect both in Parkinson and in Alzheimer's as well. In the next slide, I will be showing the effect of GT2287 on locomotion. If you can activate the video, please. So to your left, you can see a comparison between non-rotenon injured rats, rotenon injured in the middle of the videos, and rotenon injured plus 2287. As you can appreciate also from the activity track map to your right, GT2287 rats have a more normal locomotion pattern resembling the non-sick rats. Can we go to the next slide, please? The next slide. In conclusion, the drug properties and in vitro and in vivo proof of concept studies are supportive of GT2287 and GT2229 to be candidate drugs for Parkinson and Gaucher, respectively. Therefore, we have started and will conduct preclinical regulatory studies this year that will allow us to submit HREC filing for then starting a healthy volunteer phase 1 study for GT2287 in Parkinson. This year, we will also commence preclinical regulatory studies for GT2329 so as to prepare then in 2023 HREC submission for a first-in-human study for the Gaucher indication as well. Thank you.